Greetings, Dr. Williams. My name is LaShirl Wise. I'm a senior biology health science major, and today I'll be presenting to you a PowerPoint presentation on schizophrenia. What is schizophrenia? Schizophrenia is a neurodevelopmental disorder or mental disorder that genetically affects the temporal and frontal lobe of the brain. Medical experts are not quite sure what causes the disease but feel that genes play a major role. Also, if you have a family member that has the disease, you will most likely develop it. What causes schizophrenia? The exact cause is not known, but scientists suspect genes and environment to play roles. Inside the brain, levels of the chemical messengers, dopamine and glutamate, may be out of balance. For example, brain scans of identical twins show that the fluid-filled ventricles can be large in the twin with schizophrenia compared with the twin who does not have the illness. Activity levels can also be higher or lower than normal in some areas of the schizophrenic brain. Diagnosing schizophrenia. There are no lab tests to detect schizophrenia, so a diagnosis is usually based on clinical history and symptoms. In teenagers, a combination of family history and certain behaviors can help predict the onset of schizophrenia. These behaviors include withdrawing from social groups and expressing unusual suspicion. How schizophrenia affects thoughts. People with schizophrenia often have abnormal ways of thinking. They may have trouble organizing their thoughts or maybe making logical connections. They may feel like the mind is racing from one unrelated thought to another. Sometimes they experience thought blocking, a feeling that thoughts are removed from their head. How schizophrenia affects behavior. Schizophrenia causes a wide range of behaviors. People may act incoherently or even make up words. They may act agitated or appear stone-faced. Many people have trouble maintaining basic hygiene or order in their homes. Schizophrenia can also cause repetitive behaviors such as pacing. Types of schizophrenia. There are three major types of schizophrenia: paranoid schizophrenia, disorganized schizophrenia, and catatonic schizophrenia. Paranoid schizophrenia has symptoms such as anxiety, anger, and false accusations that someone is trying to hurt you. Disorganized schizophrenia is symptoms like your childlike behavior, problems explaining your ideas more clearly, and not showing emotion. Catatonic schizophrenia has symptoms such as odd facial expressions, lack of activity, and not responding well to others. Symptoms: hallucination, delusion, paranoia are all symptoms of schizophrenia. Hallucinations is hearing or seeing imaginary things. Delusions are wildly false beliefs. Paranoia is the fear others are plotting against you. Some symptoms, such as lack of enjoyment in everyday life and withdrawal from social activities, may mimic depression. Handling the symptoms. Paranoia. A good way to handle paranoia is to place yourself beside the consumer rather than face to face. The side-by-side position tends to deflect the paranoid fears away from you. Instead, both of you and the consumer are looking out at the world together. Medicine for schizophrenia. Prescription drugs can reduce symptoms such as abnormal thinking, hallucinations, and delusions in people with schizophrenia. They work by blocking certain brain chemicals. Some people have troubling side effects, including tremors and major weight gain. Drugs may also interfere with other medicines or supplements being taken. In most cases, long-term use of medication is an essential part of managing schizophrenia. Rehabilitation. Rehabilitation may include job training, money management counseling, and guidance in public transportation or shopping for groceries. The goal is to help people with schizophrenia stay employed and maintain as much independence as possible. Rehabilitation programs are particularly effective when combined with psychotherapy. The picture that you see to your right is a picture of the UCLA Center of Neurocognition and Emotion in Schizophrenia. In that picture, you see people of different race, age, and gender, but they all have one thing in common. Each one of those people suffer from schizophrenia. Relapse prevention. People with schizophrenia sometimes quit their medications because of side effects or a poor understanding of their illness. This raises the risk of serious symptoms returning and triggering a full psychotic episode. Regular psychosocial therapy can help people stay on medication and avoid a relapse or the need for hospitalization. And that concludes my presentation on schizophrenia. Thank you.